before I start, I'd really love to tell you that we are live on Facebook and on Twitter. You can follow us there as well as we share with your friends so that they can follow this program online. And you can, because of time, I really love everyone to introduce themselves on the chat box. Yes, that just write your name, where are you coming from, and what you do to the community. Yeah, thank you. So before I start, my name is Veronica Akinyi. I work at Disability Trust. Disability Trust is an organization that advances the rights of women and girls with disability in Kenya. We are based at Togoto in Kikuyu. Kikuyu is in Kiambu County, and it is, I can say it is an extension of Nairobi County. So we are basically Nairobi. And at Disability Trust, we have different programs that are running concurrently. The first program that I'm going to talk about is our Mama Series program. And we have our Mama Series from different counties. We are in 8 counties, but we have added 5 more. And currently we have 5 more counties. The counties are, we are in Gishu, we are in Kakamega, Kisumu, we are in Nairobi, Kajiado, we are also in Kwale, Kilifi, Mombasa, and Isiolo, Mandera, Wajir, and 2 more, yes. So those are the counties that our Mama Series are present in at the moment. Mama Series is a referral program that provides referral to our callers. When they call, they receive a referral. And our Mama Series, who are focal points at these counties, they help in this situation. When you call, when you dial a number, the number is, and somebody can help me write it on the chat box so that everyone can get it. The number is 0800 000 300. Then when you call that number, you will be referred. You'll be hearing about somebody talking, and you'll be told to dial a number with regards to each county. For example, number 1 will be Nairobi, and in that order. So when you press a number, you'll be hearing a lady talking, and you'll hear the person telling you to dial a number with regards to the county that you're coming from. So that is Mama Siri. I'm going to give it just a brief description. And with regards to Hesabika is our platform where we capture the data of persons with disability in Kenya. And I can proudly say it is one of its kind, and it captures both the data of men and women in Kenya. So the number, somebody can also assist me write it on the chat box. When you dial that number, we capture your data so that we can be providing you with information that are related to, for example, right now we have El Nino. We can be telling you to keep safe and make sure you're on high grounds and going out when it is raining. So such kind of information we pass to persons with disability that has already registered in our platform. Craig has already written the number there. It's *548#. And you will follow the same procedure, and you will capture your data. Another program that we have is called Skills. Skills platform. This is a platform where we have different learnings going on, online learnings that are going on. We have our digital data program, and we have our healthcare providers program. For the digital data program, we train the data on the digital marketing skills and some part of digital literacy. We also provide them with mentorship program, and also part of it is on mental health. And for healthcare providers, we train our healthcare providers on the needs of persons with disability when they visit a hospital. And this usually helps because sometimes persons with disability, when they visit a hospital, they're usually misjudged. So we are trying to break that stereotype and the stigma that usually happens in the hospital by training them on the needs of these women and of this person with disability when they visit the hospital. Last but not least, we have a Sarechar Plus D Festival. It usually happens once a year, and we regretfully say that this year we will not make it happen because we have a natural catastrophe that happened in, we were supposed to take it in Mombasa, but due to the heavy rains that we experienced, we painfully regret that we have to postpone it to a later date. So those are some of our programs that we run. And now I want to welcome everyone to today's session. And as you all know, we are commemorating the 16 days of activism, and with a focus on gender-based violence. So let me start now. Ladies and gentlemen, Mama Siri, esteemed participants and advocates of equality, I am honored to welcome you to the third installment of our webinar series, moving into the crucial intersection of corruption and the autonomy of women with disabilities. Today's discussion is a painful reminder of the pressing need for collective action against gender-based violence. As we convene, we stand united in commemorating the 16 days of activism, reinforcing our commitment to eradicating the prevalence of violence that affects women globally. Central to our discussions of today will be the role of civil societies in addressing inclusion and accountability in the fight against corruption and ensuring equitable distribution of resources. Civil societies, as the backbone of social change, they play a pivotal role in holding institutions accountable and advocating for policy reforms. We will shine a spotlight on the initiatives and successes in their pursuit of justice and equality for women with disabilities. The timing of gathering is not random, but it is also purposeful. The 16 days of activism against gender-based violence serve as a reminder that the fight against corruption and for the autonomy of women with disabilities is integral to the broader struggle for gender equality. It is a call to action, urging us to turn our discussions into tangible outcomes, policies, and practices that empower and protect the rights of women with disabilities. So the objective of our webinar today is going to be, we want to explore the vital link between corruption and the autonomy of women with disabilities, with a special focus on the involvement of civil society organizations. That is going to be the objective of our today's webinar. We have two desired outcomes for this webinar. And one, we want to showcase the pivotal role that civil societies play in addressing these challenges. This involves the impact of civil society organizations in promoting the rights and autonomy of women with disabilities. Our second outcome that we desire to achieve after this webinar is, in alignment with the broader theme of the 16 days of activism against gender-based violence, the webinar serves as a platform to commemorate this campaign and reinforce the commitment to combating violence against women in all its forms. So today, as we embark on this enlightening journey together, let us rekindle our collective commitment to building a world where every woman, regardless of ability, enjoys autonomy, freedom from violence, and equal opportunities. May our deliberations today serve as a catalyst for transformative change and inspire us all to be steadfast advocates for a more inclusive and just society. Thank you for joining us on this critical exploration, and I look forward to the insights, experience, and solutions that will undoubtedly emerge from our shared dialogue. So once again, I welcome you all, and we are happy you took this time. Let us all have an engaging session. I take it back to our facilitator, Juma, to take it from there. Let us have our wonderful session. Thank you.
Before Juma speak, sorry, kindly let's note that we have a translator. So let's not speak fast so that he can translate. Thank you. Juma, you can go ahead.
Thank you so much, Clarence. Good afternoon and welcome to the third webinar on corruption and how it intersects with bodily autonomy of women with disabilities. And it is indeed a great way to kickstart the commemoration of the 16 days of activism against gender-based violence. So I can see that you introduced yourself, and I can see Daisy Ochola from Organization of African Youth. Thank you so much. Bozi Badia, thank you for joining us. And thank you for joining us. I can also see Eva Awira, thank you. And Tawhida Salim Masiri, good to see you. Rachel Lafundi, good to see you. So I would like to help us gauge the atmosphere and maybe get to know a little bit about ourselves. So before I introduce the speakers, I'd like us to quickly go to your Google or your browser. You can use Google, Phoenix, or whatever, and you're gonna type menti.com. It's on the chat box, menti.com. After umetype menti.com, utaletewa akasa hapo hivyo ya the code. The code is 77415818. 77415818. So these are just our icebreakers kutusaidia yani tukuwe na some energy in the discussions that we'll be having today. It's a platform. Banis Kaya, I can see your question. It's a platform ya kuuliza maswali. So to gauge the situation, yani to gauge our atmosphere today, that tujue like mwelekeo yenye tunachukua kwenda kwa hii webinar. So it's menti.com. Type on your browser menti.com 77415118. Niwie radhi ni 77415818. Hapo hivyo kutakuwa na maswali. Our first question is what's your name, where are you from, and what do you like most about yourself? Nimeona wengi wetu tumejibu kwa chat box, so we can go to the next question. Our next question is describe how you're feeling today in 3 words. Yani tujue tu vile tunahisi as we start this webinar. Our third question will be, what are you hoping to get out of this session? And our third question is, what are you hoping to get out of this session? And the last question is, if you could be given one superpower to fight corruption, what superpower would you choose? Kama ungepewa superpower moja ya kufight corruption, ungechoose superpower gani? So as we answer those questions, I will quickly invite our speakers to introduce themselves in 1 minute before we start our discussion today. Our first speaker will be Witseria. Witseria, welcome. We're not getting you, Itzeria. Could you kindly turn on your microphone?
Hello.
Clarence?
Terry,
Hello.
thank you. Yes, we can hear you now.
You can now get me?
Yes.
Hello, guys.
Hello.
My name is Wisteria Wafula. I'm a youth advocate. I work with Black Albinism organization that handles matters climate change, focusing on the people with albinism. I'll be a speaker today, handling the topic in reference to the matters climate change. Thank you.
Thank you so much for the introduction, Itzeria. Our next speaker will be Mercy. Mercy, welcome.
Thank you very much. I hope I'm audible enough.
Yes, you are.
So my name is Mercy Mugesha. I'm a student at Kenyatta University pursuing a bachelor degree in gender and development studies. I am a youth advocate. I advocate for sexual reproductive health right matters, and I'm also a member at Community Voices for Change. It's a CBO organization at Korogosho that foster education in the community and tries to help how young girls and all people that are not enrolled in education that can access education. Thank you.
Thank you for the introduction, Mercy. Our next speaker is Daisy. Daisy, karibu sana.
Good afternoon, everyone. My name is Daisy Chola from Organization of African Youth. I support monitoring and evaluation. I'm very happy to be here. At OAY, we work around young people, and today I'm going to take you through governance among young women. That's why I'm here. Thank you all.
To know where you're working from, Daisy. Thank you for the introduction. Our next speaker will be Kelvin. Kelvin, karibu.
Asante sana. I hope I'm audible enough.
Yes, you are.
Okay, my official name is Kelvin Joroge. Preferred name is Kayla. I am a youth advocate at Ambassador for Youth and Adolescent Reproductive Health Program as a key populations lead. Yes, thank you so much, and back to you, Chair.
Thank you so much, Kelvin. Bozi, welcome. Bozi, can you hear me? Bozi? We can go to our next speaker as we wait for Bozi. Our next speaker is Belinda.
Hi everyone. And so my
Hi.
name is Belinda Udur. I'm a disability champion, a champion for disability rights and sexual reproductive health for girls and women with disability. I'm a mentor from the community level, and I work at APDK as a communication and advocacy officer. Thank you.
Welcome, Belinda. To our speakers, thank you so much for joining us, and we are really grateful that you're here, and we are hoping that we'll have a meaningful engagement today. So our discussion today will be centered on how does civil society work to address inclusion and accountability in the fight against corruption and ensure equitable distribution of resources? How How does civil society work to address inclusion and accountability in the fight against corruption and ensure equitable distribution of resources? Our first speaker who will speak on the issues, Wisteria, welcome.
Hello, guys.
Hello.
Thank you so much. Thank you so much for your time and welcome to my presentation. And today, the question is the question that we are handling today, just to have a look at it and people get to know. It's about how does civil society work to address inclusion and accountability in the fight against corruption and ensure equitable distribution of resources for women and girls with disabilities. And in this matter, I'm going to focus on climate change. So I'll go straight into the topic. And civil society contributes to addressing inclusion, accountability, and equitable resource distribution for women and girls with disabilities in the context of climate change in the following ways. And the way that's the one way in which civil societies can do to handle or to ensure inclusivity in the climate change is advocacy. Civil society organizations advocate for policies that specifically consider the needs and the challenges faced by women and girls with disabilities in climate change initiatives. You all know that climate change is a trending issue, not just in our country, but in Africa and the world at large. So this includes promoting inclusive decision making, their voices and their voices are heard. Then number two, capacity building. Civil societies work on building the capacity of women and girls with disabilities in actively or to actively participate in climate change discussions, ensuring that they have the knowledge and skills needed to engage in decision-making processes related to resource allocation and climate action. In this case, this will enable women and girls to also be involved in the climate action initiatives more lively. Three, monitoring and reporting civil society. That's monitoring and reporting. Civil society actively monitors the implementation of climate change policies to ensure they are inclusive and benefit women and girls with disabilities. They report on any discrepancies or rather any shortcomings, lack of accountability or instances of discrimination to hold relevant stakeholders accountable. So they'll just report cases that they come across that in whichever way they discriminate women and girls with disabilities in matters climate change. Four, research and data collection. These organizations, I mean the civil society organizations, engage in research and to gather data on the specific challenges faced by women and girls with disabilities in the context of climate change. And this evidence is crucial for advocating for targeted policies and resource allocation. So when they engage in research to gather data and the specific challenges that women and girls are facing, so after they present such data, it's crucial in the targeted policies and resource allocation to women and girls living with disabilities. Then partnerships, that's a fifth way. Civil society organizations often collaborate with government, international organizations, and other stakeholders to promote inclusive practices. By fostering partnerships, they can influence policy development and resource distribution to address the unique needs of women and girls with disabilities. Through this collaborating with the government, of course, and other international bodies, they can have a chance to influence some policies so that women and girls with disabilities are more included in the fight, or rather in this climate action. Last but not least, awareness campaigns. So these organizations conduct awareness that is campaigns to highlight the intersectionality of issues faced by women and girls with disabilities in the context of climate change. This helps build public support for inclusive policies and actions. So civil society organizations, they go around making sure that the public is aware of the fact that there is climate change. Not only that, they also make sure that the policies that are made, and in this case, the policies in the climate change action will also favor women and girls with disabilities. Yeah, so even women and girls with disabilities in our populations who doesn't know or who are not aware about the actions, through this awareness, they'll be able to gain knowledge and information about climate action, and even know more about their crucial what I mean in this situation, and how they can contribute in this case, climate change. I think that's my presentation, and I don't know if there's any question that anyone could have, so that I can address it.
With Seria, we'll
Yes.
be taking our questions after the session. We'll be having around 15 minutes after the speaker session where we'll take questions and answer our questions. So I would like to advise you to note down the question. Then after the session, we'll come back and answer. The speakers will come back and answer them.
Okay, thank you so much. That was my presentation.
Okay, thank you so much, Iteria. Indeed, collaboration is a good way to work on matters of climate change, and I commend you on the work you're doing. The next speaker will be Mercy. Mercy, welcome.
Thank you very much. I hope I'm audible enough.
Yes, you are.
Thank you. So our question for today is how does civil societies work to address inclusion and accountability in the fight against corruption and ensure equitable distribution of resources? So I'll be focusing on the education system. Yes. So civil societies work to address the intersection of corruption and bodily autonomy of women with disability in education system in so many ways. Before I go to how civil society work to bring education and knowledge to women and girls with disability, I'll take you through some statistic data that we have. So according to Gishuki 2022, it is very disheartening that only 6% of children with disability are enrolled in schools. In Kenya, children with disability are 55% less likely to enroll in schools, and when they do, 60% are likely to drop. Only about 72% of children with disability and special need live in the rural areas, and 27.4% we have them in the urban areas. So there are so many organizations or civil societies that we have that have alliances that work together with the government to bring education to our girls and women with disabilities so that they can have education. So the civil societies play a crucial role in fostering education by, number one, it is advocating for the rights of women and girls with disability to access quality and inclusive education that respect their dignity, diversity, and potential. By doing so, these civil societies bring ensure that transparency is attained and more girls get access to the fundamental right of education. It is worth noting that if we want to, as we are on 16 days of activism against gender-based violence, if we don't educate, if education is not at 100% given to girls and women with disability, we might not be able to attain a positive or 100% transformation on gender-based violence. Also, this civil society, they do challenge the barriers and biases that prevent women and girls with disability from enrolling, staying, and succeeding in school, such as by lack of accessing infrastructure, materials, and transport, negative attitude and stereotypes, and also the violence and harassment that come when our girls and women with disability face when they're enrolled in education. So they keep following up that that our girls and women with disability, they stay in school, that they are getting the quality education they deserve, and also there are no negative attitudes that are there or that are facing them. Another role that civil society does to eradicating the corruption in education is by monitoring and reporting on the implementation of international and national commitments and obligations related to the rights of women and girls with disabilities in education. So civil societies continue to follow up, they monitor, and also they give annual reports on the implementation that are made at a national level and also at an international level to make sure that education is fully attained. To my last point, civil society build alliances and network with the government and other civil society actors, as well as engaging dialogues with collaboration with governments, donors, and the private sector to promote anti-corruption measures and ensure equitable distribution of resources for women and girls with disability in education. So by fostering these alliances, they are able to contribute and bring more women and girls into the education system, and they make sure that education, this fundamental right that is essential for every human being, is also not excluded for our women and girls with the disability. Thank you. Thank you. That has been my presentation.
Thank you so much, Mercy, for your presentation and great work on what you're doing on swala za masomo kwa wanawake na wasichana walemavu. I would like to, before I invite our next speaker, I would like to ask us to write our question on the chat box, then we'll answer at the end of the session. Write the questions on the chat box and we'll answer at the end of the session. Right now, I would like to invite our next speaker, Daisy. Daisy, welcome.
Thank you once again. I'm going to take you through my presentation today, where I'm focusing on governance among young women with disabilities. So to answer the first question, the question that I was to tackle, it was role of civil society in promoting inclusion and accountability in the fight against corruption ensure equitable distribution of resources in promoting responsive governance among young women with disabilities. I'll just go straight to my first point, where CSOs can capacity build. Through capacity building, we know very well people in the community where these women are, we are supposed to capacity build both the women, our stakeholders. Who are our stakeholders? This includes our leaders, other CSOs, so that we get to know literally what's happening. We can't capacity build other side and leave the different and leave others behind. We have to include our gender persons here, our nyumba kumi, our chiefs, and to this discussion. You have to capacity build them. They have to get to know the knowledge. Anyone can encounter corruption at different levels. When you encounter corruption, what do? You know what to address, you know which issue to talk about with facts. You just don't go ahead and say, I encountered corruption and all this happened. Are we able to say, I encountered this? Can you show evidence? It's very easy to follow an issue with having evidence. So I therefore call upon CSOs to continue capacity building the community, different stakeholders, and the duty bearers. These people can help us fight against corruption. Then my second point, I'm going to talk on legal frameworks. And under legal frameworks, we encourage CSOs to continue advocating for anti-corruption laws that have gender-sensitive disability inclusion. When remember the 3 gender rule, what do we consider about? There, the 3 gender rule is not it is not talking about someone with disability, someone with no disability. When you're talking of women, we should have them on the table. No man should be left behind. They should be there. These legal frameworks, they have to bring on board legal frameworks that is protecting them, that is considering them. When these decision makers come to the table with us, with young women with disabilities, they call us here. They say, we want to build for you, we want to build on our government behind. We have to include our gender women disabilities. They call us here. They say, we want to build for you, we want to build on our government behind. We have to sorry for that. We have to include everyone on the table. When people are called on the table to discuss something on governance, your leader says leaders is not just supposed to be the governor, the MP. Our leader starts even from yourself. The nyumba kumi is a leader. All these people know our households. Then we say, we want to build for you an hospital with only the lift. It's the role of us, it's the role of us to sit there and advocate for legal frameworks that favors us. Then my third point, I'm going to focus on partnership. When we say partnership, it is not all about who you know, but it's all about working together, CSOs coming together. We know the spirit of working together promotes inclusivity. And it's very easy when you work together. You are able to follow an issue. You are able to make a follow-up. You are able to, someone tells you, I encountered corruption at this level. It's not a must. You have to know someone all along your way. Just at the comfort of your bed, comfort of your seat, someone tells you, I encountered corruption. Kindly, can you help me follow on this? You are able to come out from where you are. Just make one phone call. Hello, can you able to help me this? That's through partnership. Not necessarily you must know the person doing it, but the person I know knows someone. What will we be doing? Building partnership, working together. Let's promote inclusivity. Then my second last point, awareness creation. And we know very well there are many awareness creation outside here. But how many times do we see young women with disability considered? How many times do we see people with disability being encountered? It's now high time that CSOs should come upon, and we continue advocating for creation of awareness. Do we see? It's very normal. We see audio visuals. Are there brailles? the language interpretations person are always there. I continue calling upon the CSOs to continue sensitizing the public. And when someone is sensitized, what does it lead to? Active public participation. You are called somewhere, you are very eligible, you know what you're talking about, you'll go there with confidence. Legal frameworks, you know what matters to talk about, what matters to include in what you are advocating for. I therefore call upon the spirit of creating awareness in our community levels. Then onto my last point is monitoring and evaluation. CSOs have the capacity, and it's their role, not their role necessarily, but what we can do, it's part of us. They can do monitor and evaluate what programs do the community has favoring women with disabilities. Which programs do the government has put across? Which programs do disability have? Are we able to monitor them? Is the community able to measure these programs through scorecards? Is there someone making transparency? We have to see transparency and accountability. And it's very easy. When something is measured, you can tell. We wanted a school academy and not a hospital. Through monitoring and evaluation, through public participation, the community will be able to speak on their priorities and evaluate what has been done and what has not been done. I therefore call upon CSOs to continue doing the work they have been doing and continue advocating for women with disabilities on governance and accountability. Thank you.
Thank you so much, Daisy, on the point of legal frameworks, being gender sensitive, being able to advocate for policies that are inclusive. And I have a question that I will be typing on the chat box so that you can answer at the end of the session. Our next speaker is Kelvin. Kelvin, karibu.
Thank you so much for this opportunity. I hope my speaker is loud enough.
Yes, it is.
Okay, thank you. I will be tackling addressing the impact of corruption on sexual reproductive health and rights of women and girls with disabilities. First and foremost is just to give a brief background on what all this really means is that civil society plays a really crucial role in addressing inclusion and accountability in the fight against corruption. Positively, civil society engages in advocacy and in advocacy for transparent policies, equal and non-discriminatory SRHR services. So with that, fostering accountability and ensuring that resources reach the intended beneficiaries and communities engaged in these services. I will also share some more positive impacts as well as some other negative impacts that we've seen with civil societies. And here are some. Basically, I'll just be going through my document, and then So one of my positive impact points is that they've had tailored programs for inclusive SRHR services designed for women and girls with disabilities, capacity building for informed decision making, where women and girls with disabilities are involved in every decision making policy implementation programs. My third point is advocacy for inclusion and community empowerment and support. This is where civil society fosters community empowerment by providing support networks for women and girls living with disability, creating a positive environment that encourages access to SRHR services without fear of discrimination. My last positive point is that legal protection and rights advocacy, where civil society engages in legal advocacy to establish and enforce protections for the rights of women and girls with disabilities, and creating a positive legal framework that safeguards the access to SRH services. To my negative impact points, I just have 3 of them. One is the one that we've not been able to curb, which is stigma and discrimination. Despite our efforts, stigma and discrimination still persists, hindering access to SRHR services for women and girls who are living with disabilities. Also, resource misallocation and corruption, which is a very big issue, and that is basically why we are here today. Where corruption in resource distribution can negatively impact the ability and quality of SRHR services for vulnerable groups and such as women and girls who are living with disabilities. And to my last point is lack of accessible information and insufficient training for healthcare providers. I mean, inadequate provision of accessible information can be a barrier. Civil society addresses this by advocating for the issues of diverse communication methods to ensure that information about SRHR is accessible to all, including women and girls who are also living with disability. And with that, I conjoin it with my last point, which is negative impacts can rise from insufficient training of healthcare providers on the needs of women and girls who are living with disability, where now our civil societies needs to come in and advocate for such. I don't think I have anything else to say, but if you have questions for me, please drop them on the chat. Thank you, and back to you, Chair.
Thank you so much for your input, Kelvin Joroge. I would like to invite our next speaker, who will be Belinda. Belinda, are you ready?
Hi, thank you for this opportunity. So my name is Belinda, and I'll be talking, and I'll be addressing the impact of corruption on sexual reproductive health rights of women and girls with disabilities in Kenya. And my angle will be focusing majorly on the body autonomy, where I will start with advocacy on the importance of sexual reproductive health for girls and women with disability. And this should be done from the community level as per what I was seeing from the ground, because I did some research on this. This should be done from the community level and not only sensitize persons with disability and women only, but it should cut across where we should engage both men with disabilities and men without a disability at the same time. And civil society organizations are doing quite a good job. They're doing sensitization on SRHR, yes, but they are targeting only women with disability. So there is a big gap where we have women without disability and men without disability being left behind. And I believe collaboration is power. So if we can do it as a team, then definitely the information will get home. The other point is I looked at a number of civil society organizations that deal with matters concerning women and matters concerning human rights. And it came clearly that yes, the rights are there. The women rights are there, like you're not supposed to be bullied, you're not supposed to be harassed, but there is no place that disability is mentioned. So I feel because when you look at the hierarchy of disability, you see we have men without disability, then followed by women without disability, then followed by men with disability, then followed by women with disability at the lower point. So basically that tells you that we are down there struggling to come up as women with disability. So I think when coming up with these policies and these guidelines that are supposed to guide all these policymakers, like to be able to ensure that no harm is happening to women and girls with disability, we are supposed to be on these tables to address the matters concerning us. So I also checked on the importance of doing sensitization to doctors, nurses, and health practitioners. And this is because a few years ago, we've had women with disabilities who've lost their lives on maternal beds. So this tells you there is a gap. These doctors, nurses, and health practitioners don't understand disability. You might be having cerebral palsy, yes, but it is not the cerebral palsy they know. Remember, we have different types of CP. We have mild, we have severe, and we have the only that has affected one body side. So thinking from that angle, I think medical practitioners are supposed to be guided and helped on how to handle persons with disabilities when it comes to maternal health rights. Then I also looked at access to family planning methods. And this came out clearly that women with disabilities are not able to access these services, not because of the inaccessibility of the healthy facilities, but no, even the reception at the health facilities is not proper. That tells you that discrimination is still high, and poor sensitization was done, because when we talk of disability-friendly services, we don't just talk about the RAMs. Basically, we talk about from the RAM, from the reception, from the people handling you, and how they look at you while handling you. Remember, eyes can also be discriminative. From there, I looked at what Mama Siri is doing, and I'm glad Mama Siri is doing a good job, because I realized most women and girls with disabilities, when they have issues concerning sexual reproductive health, they reach out to Mama Siri. If they have matters concerning being harassed or bullied, they will call Mama Siri to get guidance. But I feel there is still a gap, and this gap comes in where we have women who have shared their stories, yes, but is there a way that we know very well you're not supposed to talk on someone's personal data without their consent, but I feel that if these women can come out and speak about these matters to other women with disabilities, it will give them power to be able to defend themselves or even speak when they are harassed. Remember, disability itself is discriminative. And now you bring in a person who is an LGBTQ and is a person with disability. It's double strategy, double tragedy, sorry. So that tells you, if we have women who have accepted themselves and are able to speak up, they should come out and speak clearly, so that we can also try and end sexual violence to women and girls who are LGBTQ community. The other thing that I looked at, the last part now, the last part is we have the Kenya Human Rights Commission of Kenya. It's a civil society that touches all parts of Kenya, but I feel there is a gap when it comes to handling matters concerning disability, especially when it comes to sexual harassment, because you realize they don't understand disability. And when a person with disability is trying to speak up of their harassment or anything, that means they're tired of it. Remember, these are people who are even molested by persons who are taking care of them, and they're not able to speak because this is my caregiver. So if I speak up, will this caregiver still stand with me? Yes, thank you very much. That was all I had for today.
Thank you so much, Belinda, for talking about the access, the challenges that women with disabilities face in access of family planning methods. So let's go to our last speaker. Our last speaker is Bozi. Bozi, karibu. You could introduce yourself and continue with the presentation.
Good afternoon, everybody. So my name is Bozi. I work with IREP, Ambassador for Youth and Adolescent Reproductive Health Program, supporting advocacy. I'll take you through some of the advocacy initiatives that can be taken to address the intersectionality of corruption and bodily autonomy. And then I'll also take you through some of the empowerment strategies for women with disabilities who have corruption-related challenges and bodily autonomy challenges. Now, for one, there is a gap in legal reforms and policy advocacy, where we can work towards influencing legislation and policies that explicitly address the intersectionality of gender, disability, corruption. Also, we can address the same through awareness campaigns, where we can say no to corruption and campaign for disability rights through organizations such as Disability Organization. And in these campaigns, we can highlight the link between corruption and violations of bodily autonomy to encourage public support and also policy. Also, we can do capacity building and capacity building for legal professionals. So I'd like to believe that even women with disabilities, they're empowered and there is room to always capacity build them and strengthen them to take up legal professions. And for this, we can have collaborative efforts between disability rights organizations and also legal institutions to provide training on rights and needs of women with disability. Also, we can do partnerships and networking. And here we can take up collaborative initiatives to address anti-corruption issues and also partner to amplify the impact of advocacy efforts by bringing together diverse expertise to address these multifaceted challenges faced by women with disabilities. For some of the empowerment strategies that we can take up for women with disabilities, I think we can increase access to information and education to enable them develop and even to easily understand materials on legal rights, on bodily autonomy, on anti-corruption measures, and generally empower women with disability with knowledge to enhance their ability to navigate legal systems. Also, we can do peer support and mentorship programs, establishing peer support networks where women with disabilities can share their experiences, they can advise and strategize to overcome corruption-related challenges. And they can also connect and share experiences with other individuals as to how they have navigated these challenges in the legal system. There is also technology for empowerment. Hereby, we can utilize technology to enhance access to justice, and also, some of the mobile applications we have that can provide information on legal rights, on individuals with legal aid services, and how to offer a platform for reporting. Last but not least, we can also do self-advocacy training where we can empower women with disabilities with skills and confidence to advocate for themselves. We can also train, we can also do training programs such as those conducted by different organizations such as Disability Organization and even Mobility International to be able to build self-advocacy skills and assert their rights. Maybe recommendations, some few recommendations that I had for different groups, because there is need to empower women with disabilities to be able to enforce legislation and even address the intersectionality of gender and disability. So for one, we can do this by recommending to policymakers that there be inclusive legislation so that women with disabilities are able to advocate for their rights and even champion for policies that they feel are not inclusive and leave them behind. Still on the same, we can also try to ask our policymakers to make justice systems accessible, and this not only applies to the policymakers but also to CSOs that handle legal issues, and we can ask them to support and give legal aid for special groups so that we can assist in navigating these challenges. And then I think something else we can do, and which is my last point, is advocacy and lobbying, where we can mobilize advocacy efforts at local, national, and international levels to ensure that the rights of women with disabilities are incorporated into policies and related and other related aspects such as gender, bodily autonomy. Yes, but this advocacy and lobbying must be strategic to be able to influence decision makers and even promote change. I think that is my presentation, and I'll be glad to maybe share it with any participant who is in the meeting as a PPT. Otherwise, thank you.
Thank you so much, Bosie, for your presentation. I thank you for acknowledging that we have a legal gap in the intersectionality and empowerment strategies. And I'll quickly now go to the lived realities of Mama series. Our first Mama series will be Regina Chumba, who will talk about health participation. Madam Regina, karibu. Regina, are you in the house? Regina?
Good afternoon, everyone.
Good afternoon.
I'm sorry, I've been in another meeting. I may not have followed everything, but I want to share my experience as Mama Siri was in Gishu County. How do CSO network help me with health matters? Whenever there's a public participation on matters health, the CSO network leadership will always ensure that we have a representation of persons with disability, so that if there's also budget, so that we are there to give out our input. Whenever I'm present, it's okay. Whenever I'm not present, they'll always make sure that I send a representative, so that our voice is heard on budget, on health matters, and everything. So I want to say that as Mama Siri was in Gishu County, I've been helped a lot by your Gishu CSO network, of which as Mama Siri from Disability Trust, we have a membership.
That's very good to know. Representation is everything, especially representation of persons with disabilities. And it's really encouraging to know that at Gishu County, persons with disabilities are involved in public health participation. Our next speaker will be Tauhida Salim.
Asante, habari zenu?
Nzuri.
Mimi ni Tauhida Salim, Mama Siri Kwale County. Mimi ningependa kuzungumzia our CSOs upande wa lands. Tunaona kama sisi tangu kutokea hili shirika la Disability Trust na tukachaguliwa kama Mama Siri, tumeweza kupata ushirikiano na CSOs. Kuna impact ya lands. Wakina mama wengi huwa wanadhulumiwa kuhusu ardhi zao. Mtu nakuta ameachiwa pengine ni mzazi wake, lakini kwa sababu ni disabled, kuna wale mabwenyenye wanakuja wanaanza kuvamia ile ardhi. Lakini tunapopata hizo issues, wanapotupa report na tunapeleka kwa hao CSOs. Kama mimi Kwale niko na group ambayo inajiita Lamukani inafuatilizia hizo cases za lands. Tunaenda field pamoja na tutaona vile ile hali iko, na tayari wana report, hata wanatafutia huyo mama mlemavu wakili na wanahakikisha mpaka anapata haki zake. Kwa hiyo tunasaidika na CSOs. Asante.
Asante sana Tauhida. It's good to know that at Kwale County wanawake walemavu wanasaidika mambo ya ardhi ili wapate, kwa sababu ni haki ya kila mtu kupata, it's every human's right to receive what they have been left for by their parent or their guardian or anyone who wants to leave their property to them. So ni vizuri sana kwamba Kwale County unapigania kina mama walemavu wapate haki yao. Our next speaker ni Josephine Leshao, atakuwa anaongelea about social justice centers and GBV. Karibu Josephine.
Good evening, everyone.
Hatukusikii
Hello,
vizuri.
good evening, everyone.
Good evening.
Mnanisikia sasa?
Ya, tunakusikia.
Okay. Kwa upande wangu ningependa kuzungumzia maneno ya social justice kwa upande wa GVV. Upande wa Kajiado County watu wamesaidika kwa sababu tangu Disability Trust ingilie kati, tumesaidika kuwatambua wale wamama walemavu wenye wanadhulumiwa, na wakishadhulumiwa tukienda kupiga ripoti kwa paralegals, tunapewa barua, tunaenda kwa polisi, tukipewa go ahead ya kushughulikia hiyo kesi. Kabla mlemavu ashughulikiwe, tuko na mahomes zile zina host hao wamama, tunawapeleka huko, tunawapeleka kama Miale ya Tumaini, tunawapeleka Beacon of Hope na Nairobi Women's ndio wanawashughulikia, kwa sababu kitu cha kwanza kama amedhulumiwa unampeleka Nairobi Women's, akionekana kutoka huko wanatusaidia, tunapewa barua, tunampeleka kwa homes. Tuko na home nyingi zenye zina rescue hao wamama kwa saa hizi, na tunashukuru kwa sababu ya hiyo, kwa sababu mbeleni walikuwa wanasumbuka sana, lakini kwa sababu tuko kwa ground kama Mama Siri, tangu Disability Trust ingie Kajiado, watu wamekuwa na mali ya kukimbilia, kwa sababu mbeleni walikuwa wanadhulumiwa na hakuna mtu ataambia na hakuna kesi inaisha tu hivyo. Lakini kwa saizi hata kabla haijafuatiliwa kuna mahali yako safe. Tunampeleka Miale ya Tumaini, Beacon of Hope na Nairobi Women's wanatusaidia sana kuwashughulikia for free. So tunasaidika na mashirika yako mingi Kajiado yenye inapokea wale watu wamedhulumiwa kingono, maneno ya vita nyumbani, wanatusaidia. So tuko na hizo Beacon of Hope na Miale ya Tumaini na Nairobi Women's, hata International Trust Treasury House pia wanatusaidia. Asanteni.
Asante sana Josephine kwa hayo maelekezo, especially for kama unajua umedhulumiwa ama nini, ama unamjua mtu ambaye amedhulumiwa, anaweza enda kwa hospitali ya Miale ya Tumaini, Beacon of Hope and Nairobi Women's. The next Mama Siri that I would like to invite is Florence Hare to talk about sexual assault.
Hamjambo.
Hatujambo.
Mimi ni Florence Hare kutoka kaunti ya Mombasa, na ninashukuru shirika la Disability Trust tokea tuanze hii kazi ya kushughulikia mwanamke mlemavu na msichana mlemavu. Nimesaidika sana. Kwa upande wangu, upande wa SGBV, huwa ninashukuru sana SIDA Kenya, kwa sababu ikiwa kuna kesi kama hiyo, akiwa yule mdhulumiwa akiwa yuko na OB, nikipeleka kwa SIDA Kenya huwa nasaidika sana. Imenisaidia sana tokea hili shirika lianze kutokea 2020, basi wengi sana hapa wamesaidika na upande huo wa SIDA Kenya. Nashukuru sana, huwa tunaenda nao vizuri. Hata saa hii wamenipatia fomu, ambayo hiyo fomu natakikana niwe nimebandika kama mahali kwa ofisi, ama yule atakayekuja kwangu nimpatie hiyo fomu, ina mdirect mpaka pale kwa SIDA Kenya, na akifika pale kesi yake huwa inaenda vizuri sana. Kwa hivyo SIDA Kenya huwa iko mbele na sisi tokea tuanze na hii Disability Trust, na limemfungua mwanamke mlemavu na msichana mlemavu upande wa SGBV sana hapa Mombasa. Kwa hivyo tunashukuru sana, kazi inaenda vizuri, na ni kama Mombasa nzima washajua mwanamke mlemavu akidhulumiwa na msichana mlemavu akipitia kwangu tu, tukienda through polisi, akipata OB, akienda kwa SIDA Kenya anasaidika. Kwa hivyo nashukuru sana. Kwa hivyo ni hiyo kazi ambayo inatusaidia sana na tunashukuru Mungu. Asanteni.
Asante sana Mama Florence kwa kutuarifu about SIDA Kenya na kazi ambayo disability inafanya kushughulikia kesi za sexual assault and health services. Our next speaker ni Annette Kibaki. Karibu Annette.
Hamjambo?
Hatujambo.
Okay, pia nami Kakamega County. Nimekuwa nikifanya kazi na Civil Societies Network Hizi networks zimekuwa zikinisaidia sana kupaza hold our duty bearers accountable in times whereby hawajakuwa wakideliver jinsi sera zinavyosema. Pale ambapo tuko na policies mingi sana ambazo wakati mwingine hazitekelezwi vile inafaa. So tukishaungana katika hiyo network ya civil societies, tunajaribu kusema na wanainuka, wanatupea support kwa ajili ya defend hizo spaces ambazo zinafaa mlemavu. Hata pale kotini masuala ya cases za gender-based violence na sexual gender-based violence in situations whereby kesi haijakuwa ikienda vizuri sana, utapata wameinuka, hata wanaiweka kwenye mitandao, wanaenda kwa LCS, wanauliza ni nini kinaendelea. So unapata kesi zinaenenda vile inastahilika, na haya yote imekuwa ni kwa ajili ya kufanya kazi nikishirikiana na civil societies organizations. Pia tumeweza kuhamasisha kwa sababu ukienda kwa hiyo network ya civil societies unapata wako na thematic areas ambazo wanajishughulisha nazo. So ukiangalia network ambaye inashughulikia masuala ya elimu, wakipata mtoto ambaye ni mlemavu na hajaenda shule, na kuna hata shule ambayo anaweza enda na akaweza kuendelea na elimu na akapata kusaidika hata siku zijazo. So wananisaidia sana. Wale ambao wanashughulika zile networks ambazo zinafanya masuala ya afya, pia in situations whereby hatujakuwa na wamama ambao hawaendi kliniki, hawaendi kupata hizo huduma za mpango wa uzazi, wameweza kusimama na kujitokeza na kuambia hawa mama hizi huduma ni bure. Tukaweze kuziendea kwa sababu serikali imegharamika, na tukiacha kuziendea pia itakuwa ni hivyo. Ukienda tena zile zinafanya mambo ya leadership and governance, haya mashirika yameweza kuelimisha mwanamke na msichana ambaye anaishi na ulemavu kujihusisha mambo ya public participation, mambo ya budget making process, na hata wameweza kuwaelimisha. Ukishika hiyo kopi ya bajeti, kama unataka kuangalia upande wa afya unaenda hivi, upande wa elimu walikuwa wamewapangia nini, walemavu mlikuwa mmepangiwa nini na kilifanyika. So they've been able to educate and make these persons aware of what is expected of them. Hata mkiinuka wanawaelimisha, wanawaambia hata mkiinuka mkianza kusema mnadai haki zenu, mnadai haki ambayo hata mtu mwingine akikuja ataona ni ukweli, kuna kile ambacho kinadaiwa, because hapo nyuma walemavu wangeinuka tu na matawi, wanaanza kutembea njiani, haki yetu, haki yetu, na hawaelewi ni kitu gani haswa ambacho wanakidai. So wakati huu hata ukipata wako njiani wanaelewa na wanaweza defend the whole thing vizuri. Hata wamekuwa able kuandika MOUs wakienda hizo mikutano za hadhara za public participation budget making process. At least nimeona utofauti. So civil societies zimehakikisha kwamba mimi Kakamega niko na sub counties 12. Wamehakikisha kwamba kila sub county inawakilishwa kwa hiyo network, na sio kuwakilishwa tu, wanatafuta mtu ambaye anaweza articulate issues za disability, because hapo nyuma ilikuwaga tu mtu yeyote, hata mwenye amelemaa kidole, mwenye amelemaa macho, hana meno, lakini kufikia saa hii at least hata wakileta mlemavu on board, ukimtizama utaona kwamba ni mlemavu, na ukimtizama ni mtu ambaye anaelewa masuala ya walemavu. So nimeona utofauti Kakamega kwa sababu actually we are empowered. Ngaje yes, kuna gaps In masuala ya policies ziko policies nzuri sana, lakini mara nyingi huwa hazitekelezwi. Gaps zingine ni wakati ambazo CSO zinafanya capacity building, hawafiki kule mashinani. Wakati mwingine hapo nyuma wale ambao walikuwa wanachaguliwa ambao walikuwa hawaelewi masuala ya ulemavu, habari zinazohusu mlemavu hazikuwa inafika mashinani. So wakati huu kuna tofauti. So hiyo network pia iko na smaller networks za persons with disabilities from different sub-counties ambazo ziko affiliated kwa the larger network ya Kakamega County. So in the event that kwamba unataka watu ambao wanaishi na ulemavu, wanawake, utapata kupitia kwa network, na utapata mtu mlemavu, mtu ambaye anaelewa masuala ya ulemavu. So kufikia saa hii hata in situations whereby civil societies zenye zinafanya haya masuala na hawana ulemavu, wanaweza kusimama na kupaza sauti ya walemavu, because they are aware of the existing policies, they are aware of what is expected of matters of disability, because tunapotangamana na wao wanaelewa hata the types of disabilities. Utapata ya kwamba ukiwaambia changanya aina za walemavu unapoita huu mkutano, unapata wamefanya vile inastahilika kuliko pale nyuma when people just thought physical disability ndio ulemavu pekee. At least kufikia saa hii the short statures are involved, the albinism are involved, all types of disabilities are involved in matters of development and CSO. So nimefikia hapo.
Asante sana Annette kwa kutueleza masuala ya Kakamega County na uhamasishaji haswa kwa sera za elimu kwa watoto walemavu, huduma za upangaji uzazi, the budget making process and public participation in the 12 sub-counties of Kakamega County. Right now, I would like to invite Mama Hilda aongele GBV.
Hamjambo.
Jambo.
Jambo.
Mimi kwa majina naitwa Hilda Mzungu, mama siri kutoka Kilifi County. Mimi nashukuru Disability Trust imetuwezesha hata kupambana na mambo ya dhulma. Kilifi County dhulma zilikuwa ni nyingi sana, lakini sasa tangu tuanze haya mambo ya kupambana, tunashukuru Mungu, maana hata kuna wengine mpaka walikuwa wanadhulumiwa, wanakosa haki zao, lakini nashukuru Mungu tangu tuanze hili shirika la disability, basi naona mambo yanakuwa mazuri, tunapambana. Hata kuna shirika lingine la Fimbo Youth limetusaidia nalo pia kupambana na haya mambo ya dhulma, na pia kuna Kilifi Moms pia imepambana na hizi mambo ya dhulma. Kwa hivyo tunashukuru Kilifi County, tunaendelea kama si disability. Naona hata sijui tungekwaje, lakini sasa tunashukuru dhulma, tunaendelea kupambana nazo. Ni hayo tu, asanteni.
Asante sana Mama Hilda kwa kutueleza mambo ambayo Disability Trust inafanya huko Kilifi County, na ni vizuri kujua kwamba wanawake wanasaidika, especially wanawake ambao wamedhulumiwa, ili wanapata haki yao, na pia inasaidia kupunguza inasaidia kupunguza stigma and discrimination that is surrounded around gender-based violence. Ningependa kumwalika Rachel Afundi aongelee alternative justice systems.
Good afternoon, everyone.
Good afternoon.
Good afternoon.
Kwa majina naitwa Rachel Afundi, Mama Siri, Nairobi. Bonyeza namba 1. Ningependa kuongea kuhusu alternative justice system ambayo inatusaidia sana sana kwa tuseme kwa gender based violence, about vile unaweza pata lawyer, vile unaweza pata daktari, na huwa wanafuatilia sana kujua kama ulipata hizo huduma, na kama na sana sana pia inatusaidia kwa community kuhusu vile unaweza peleka kesi ambazo zinaweza enda kotini na zile zinaweza fanyiwa kwa community, and that's why walijitolea kama shirika kwa community alternative justice system, ndio waweze kuchukua cases ndogo, kama tuchukulie kwa mfano kama GBV cases ambazo kama haina rape case, na wanatatua hapo na hapo, na kama itashindikana sana ndio inapelekwa kotini. And then pia tunafanya kazi na Beacon of Hope. Beacon of Hope wanatusaidia about implementation, quality implementation kwa community, ambayo watu waweze kujielewa na kujua nini inatakikana na wapi panatakikana, nini inatakikana kwa community na nini haitakikani. Kwa mfano tuseme kama ni watoto ambao wanakosa kwenda shule na wako na virusi, wanajua vile watafanya, na wana make sure that wamekumbatiana na hiyo mtoto anaweza enda shule bila shida, anapata dawa yake bila shida, na pia tena wanang'ang'ana na watoto wasichana walemavu, at least waweze kupata kama maybe ni college, na hawezi kuendeleza na masomo yake, anaenda college, na alafu hapo wanasaidia that huyu msichana anapata kama ni biashara, na wanafuatilia. And lastly, ningependa pia kuguzia kidogo kuhusu Kenya Paraplegic Organization, ambayo inatusaidia kwa community kama walemavu kuhusu public participation, na pia vile mtu anaweza kuwa na biashara yake, kama mama ama msichana mlemavu anaweza kuwa na biashara yake, afanye tenders na hiyo AGPO, na pia inatusaidia kuingia kwa hizi shirika za government funds, ndio waweze kujua kuwa that kuna pesa ambazo mwanamke mlemavu anaweza access kufanya biashara, na pia wanatusaidia pia if you want to register your business, pia wanasaidia hapo. Ni hayo tu kwa leo, asanteni.
Asante sana Rachel kwa kutuambia about what the alternative justice system does, kuhusu mambo ya kesi ndogo ndogo ziweze kutatuliwa badala ya kuacha hivyo, na about the Kenya Paraplegic Organization kuhusu mambo ya biashara, public participation na government funds. Ningependa kumwalika Benta Bella aongelee about referral pathway centers and social society centers.
Asante sana. Nimeshukuru kwa hii wakati. The only thing I would wish to say is that CSO zimekuwa of good use, kwa sababu unapata mara nyingi, many a times we as persons with the disabilities, za zingine kwenda kotini na vitu hizo kufuatilia, za zingine inakuwa challenge, and that's why unapata at times cases mtu anachoka njiani, kama ni mzazi mwenye ako na mtoto labda alidhulumiwa, anaenda kotini mara mingi, then unapata mzazi anachoka njiani. Lakini tunapata kama CSOs zenye tunafanya nao kazi kwa karibu, wanafuatilia hiyo kesi mpaka mwisho, because most of them they are being funded, so they have the capacity maybe ya kufuatilia sana. Then the other thing which I can say is that the CSOs, some of them sit in this court users committee, where actually at times they can give they can also give input, especially when it comes to issues disabilities. Then CSOs pia imefanya empowerment to women and girls with the disabilities and disability at large, so that they get to understand their rights. And also in Kisumu, we know that we were the first county to have the act. When the county government was taking long before its implementation and putting the board in place, the CSOs and DPOs came together, and actually the board was put in place. So we've been working so closely. They've also helped the women understand about the referral pathways, because this is where the woman will understand that what is it that I have to do from the community level to the police, to the hospital, GBV center, and things like that. So the other thing which they do is that they capacity build. And this is closely, you will find that whenever the county government is doing something, they'll always speak out and ask, why are the persons with disabilities not represented? And the other thing is that when you look at the referral pathway, at times it requires, because we know that only sexual violation is free when one wants to maybe to take an P3 form, but then when it comes to GBB, then the person has to pay. So you find that some CSOs have always been ready to assist, especially when it comes to issues of women and girls with disabilities. And also the referral pathway actually has made the work easy, because the women understand that from here to here, then this is the position. Then the justice centers have also been of use, and we know they are being owned by these civil societies, because you find that they come up, they assist, especially when we want to make some of the policies, maybe issues of GBV, sexual reproductive health, they normally come and assist. And I believe the partnership between the CSOs and even now disability in Kisumu County is of good use to women and girls. Thank you so much.
Asante sana Benta kwa kutueleza ambayo yanatendeka huko Kisumu County kuhusu kufuatilia kesi, court users committee and the referral pathway networks that someone can do to access, that someone can follow to access justice. Next, I would like to invite Mercy to talk about CSOs for leadership.
Okay, good afternoon or good evening, everyone. I trust all we are well in the Lord. This is Mama Siri from Narok County, ready to present the issue of Narok on girls and women with disability. Narok is one place, or Narok is one county that women don't own anything apart from kuku na maziwa. That is the only thing that a woman can say that belongs to her in Narok County. And tulipozaliwa tulipata tu leadership iko hivyo on women and girls, especially women and girls with disability. You don't have a right to own a land. You don't have a right to own anything that belongs to the community as a woman. Okay. In terms of leadership, I remember on 2017 election, we lost our seat due to politics issues on leadership. The position on representing of person with disability went away with another lady. She claims that she's disabled because she was or she's circumcised. Yeah, we understand that Narok, women from Narok mostly must pass through that, the FGM. So that is one thing we talk of leadership. We are so behind. We are very much behind on leadership on women and girls with disability. As I understand that to access justice also in Narok ni ngumu sana. You can't access justice in Narok County because ukijaribu kuongea, maybe umeenda kwa mkutano as a woman, you don't have a right to talk because you're a woman, and to make it worse, you're a woman with disability. So people see that you don't deserve to talk. Narok is one county that children born with disability, both gender, female and male. Narok is one county believe that that is a curse. So most of the time they do all their best to make sure that she or he is no more, cannot exist in this world. So for us who acquire disability tukiwa watu wazima, it's still a challenge. We can't make to talk. We really take, we really fight. I don't know. We take it by force. We do it by force for us to talk, for us to attend those public participation, for us to attend those government meetings or government training or government forums. We have to use our own force. And since the governments know the laws that if the government is holding any meeting without a person with disability is against the law. So tunapata hiyo information when it's too late, na tukishapata hiyo information still to access the area ni vigumu, it's not easy. So for me, I would like to say that I wish if you can empower the women with disability and girls to advocate their rights. We are still behind. Let me say we are still behind on advocating our rights. I wish we can do something better so that all women with disability and those young upcoming girls with disability can also know their right. And normally, and pardon? Hello? Okay. Now, again, Narok is a place whereby educating a girl is not a must. Tena tukiongeza a girl with disability, hiyo ni zero tolerance. They don't educate them. So we need a capacity building. We need a lot of training in Narok County on women and girls. May I just add all disabled, not girls or women, even men. We need to do a capacity building to the caregivers, to the family members. Last week, I came across a young girl. She was diagnosed by, I don't know if tunaitaje, akona cerebral palsy. So the parents walimuignore. She was, I took her to the hospital. She was admitted for 1.5 weeks. I thank God she was, I'll tell hospital on Friday last week. She went home. The bill was waived away, and that's due to my concern. I went there, I make a lot of noise that she's not supposed to pay anything according to the government rule. Now, because the mother was so quiet and she's a woman again, she was just assumed that like she know nothing. So she was just assumed, and she's a woman. Narok is a place whereby they don't tolerate anything that a woman speaks or talks about. So we still need a lot of capacity building on women. we still need to do something good, physical education on women and girls with disability. Also the caregivers, we need to do something with the caregivers. The caregivers really don't understand their role, and I won't blame them, only that wako kwa denial. Wako kwa denial like a woman, I'm a woman. Let's assume that I was not a disabled. Nikiza mtoto disabled, I'll see or I'll feel like I'm out of the community. And hiyo ni kukosa hiyo kuhamasishwa. Sijahamasishwa ya kwamba kuza mtoto mlemavu si laana. So I wish we can chip in, or we can talk to more NGOs, to many NGOs, wafanye hiyo training, watembelee those community ambayo kuna disabled children, they accept themselves. Also they accept the siblings yenye Mungu amewapatia, because this disability unapata tu anytime any day. You can't apply, either utazaliwa nayo kama utapata tu ukiwa mtu mzima. So I wish we can do a capacity building on disability issues. Tena tufanye capacity building and education, because in Narok they think that a child with disability, she or he don't deserve to go to school. Little they didn't know that wanaweza soma na wakuja wakue better people in future, wakuja wainue hiyo familia which was down kwa sababu amekuwa educated. So I don't blame them, it's lack of not knowing or not understanding that disability is not inability. So I wish I can just stop there as I think on what to add more, please.
Hey, Juma, you're on mute. On mute.
Yeah.
Sorry. Thank you, Sana Masi, for highlighting the challenges that women with disabilities face in Narok County.
I have an issue or an input. As ourselves, we are still discriminating our own. And I'm sorry to say this. There's one of ours, they are using a word living with. Please, might take this time to correct him, because him, we are not living with. Please make a correction on that. We are person with, not living with. We are not living with. That word living with discriminate a lot. Thank you.
Asante for that correction. And ni ukweli, ukisema a person living with inamaanisha kama tuseme mimi Juma niko hapa, disability yangu iko hapa kando. Yeah, so we should try as much as we can to correct that when we are talking about persons with disabilities.
Sure.
Mama Siri kutoka Isiolo, Abdia. Abdia yuko? Wacha tumpe muda as we continue with our next session. Our next session.
I have a question. Or I also have an input. What can women be done for they to be included in budget making process and those kwa hiyo public participation? I wish we can do something better for them to come out. Alafu for them, although normally they complain that wanapata information after the public participation is done, so wanapatia information when it's too late. So I don't know what we can do better for them to have that information earlier, like 3 to 4 days before, because women are going through a lot of things which they can't talk. And we need to empower those ladies or those women with disability or those caregivers because the caregivers mostly ladies. For them to be aware that they need to come out before and they need to speak themselves, because nothing for us without us. We can't make it if you don't talk. We can't make it if you don't come out. We have to come out for us to get what belongs to us.
Okay.
Allow me to speak.
Mhm.
Just to answer a part of what she has asked. The budget making process has a calendar whereby specific dates are spelled out on what should be going on in the whole budget making process. So if you can get, you as Mama Siri, get somebody who is a champion in the budget making processes from the civil society network where you come from, convene women and girls with disabilities or generally persons with disabilities, let them be made aware of this debt so that we say it is our responsibility. Nobody should force you to attend these meetings. Ni jukumu lao. They should know it is their responsibility to come out during this forum so that they can be a part of the process. Because if the process goes on without them attending, without them knowing that it is their responsibility, then much of what they require will be left out. So from where I come from, we've really tried to mark these dates so that when it comes, they know it is the ADP, it is the physical paper, they've marked those dates. So they come out in large numbers. It's just a matter of reminding one another. You remember this, it's on.
Asante sana.
And if you want a soft copy, I can send you.
Okay, thank you.
Welcome.
Asante sana Annette for
Karibu.
the input. Hata tumeshaingia kwa the second last session about the question and answers, and ningependa ku invite other people wenye na maswali ili weze kujibiwa na our host, our speakers and our Mama Siri. Kuna swali lingine? As we prepare our questions, I have some questions that I would like to direct to our speakers. Belinda, if you're around, I do have a question for you. You talked about access to family planning methods. You as as a representative of APDK, what are you doing to make the accessibility of family methods for women with disabilities more friendly so that they can access them?
So for APDK, what we did last year, it's a campaign that started last year where we were having conversation with the SACCO managers, because we realized you can talk with a tout or a driver, but what if the driver changes? Like if this driver decides to go and work in Kisumu and he has the information. So we trained the SACCO managers on accessibility matters. We even took them through a process in which a person with disability is supposed to board a vehicle, but because that was not enough, their only complaint was that Kenya should change the type of chassis we bring when we import vehicles for public transport. We check on the chassis. The chassis should be not the lorry ones. We should use the ones for buses that are disability friendly and are even used in the other countries. Again, the challenge was that when they bring those vehicles, our roads are bad. Our roads are not able to accommodate vehicles with lower chassis. So I'm glad that we have the super highway, and we also have the Wayaki highway. These ways were constructed in a manner that they are friendly to vehicles that have lower chassis. But apart from that, we're still having conversations in here and there with the drivers, totes, and the managers. We talk to the managers, but now the managers are passing it to the totes and the drivers. And in case they need clarifications, they call us and we do sensitization. So the vehicles that we did sensitization were the Super Metro, we did Latema Sacco, we did Forward Travelers. Though for Forward, we were not able to get all the managers. I think all of you understand why. Forward is not that easy to deal with. We also went ahead and did a Rainbow Circle, the ones for Kitengela, and we did the ROG Circle. So it's a step by step, but in case we get any other donor who is coming in to help us ensure that that is done, we will continue with the sensitization. But for now, we stop due to funds. Thank you.
Okay, that's very good work that you're doing for the community of persons with disabilities. Hongera sana. Nilikuwa nimeona mkono ya Daisy. Daisy, do you have a question? Or ulikuwa unataka kuongezea?
Okay, I have a question. I have a question to Mercy, who focused on education. Just a quick one. What really happens to I don't know if I don't know if I'm in the correct track when I say children who are in school, the children who are disabled. What happens to these children? You find, let me just put in a layman's language. What happens to how watoto unaona shule, primary school na ni public, unaona all through, like due to ability yake, amekwamilia hiyo class. What do the CSOs do to these children? What do you advocate for? Kuna time wameisongeshwa kweli? Because I remember me growing up, there was a school I knew. Kuna mtoto alikuwa anaitwa Moi. Na huyu mtoto alishinda in that year school ya disability, like hakuwahi songa. What really happens?
Okay. What the CSOs does, we do a follow-up. We do a follow-up in every community to after how to disable. Excuse. Okay, may I answer you? As a CSOs, we did this, that we tunatembelea those family with children with disability. But their weakest point or their weakest time is they don't come out clearly. Wanaogopa kutoa hawa watoto disable nje. Hata time ya census, when census was being done, you can visit a family whereby a mother has a family of 6 children, 6 siblings. But because the 6th one is a disabled, sure, he is not counted as a child. So the moment we notice that we have a child, there is a child there, because sometimes we be good friends with the community. So the community wanna realize this child is not okay. She or he has a disability, because we include both female and male. The moment we notice that, tunamchukua tunampeleka in a special school, whereby we have two only special school in Narok. That is in Narok South and Narok North. But the big problem and the big issue, if I've understand your question, is the caregivers. They don't come out wakikubali ya kwamba they have children with disability, especially those children with cerebral palsy. Hao ndio wana undergo a very tough stage or a very tough life. I don't know kama nimekujibu vizuri. Please, you just ask me again.
Okay, ningechangia pia. From where I come from, watoto kama hao nimeona walimu wanawamark. Wakisha wamark, wanaendelea na kuna hizi free primary education funds za special unit. Wenyewe wanajipanga, kuna shule hapa Butere, kuna shule hapa Kusero. Nimekuwa nikiona wana analyze huyo mtoto, wanaona area yake of interest, alafu wana kind of mzawadi kama ni mbuzi, nimeona wakizawadi mbuzi, nimeona wakimzawadi farm kit tool. So kulingana na area ambayo huyo mtoto anapendezwa kuifanyia kazi, they'll always try to nurture the boy or the girl on that line, and then after some time they give those so that they continue doing it on their own as an income generating, and they also tell the parents to support.
Thank you so much, Annette. Ningependa naomba tutilie mkazo time because our target ni kumaliza at 4 p.m. So unaouliza maswali muulize kwa ufupi, na wenye mnajibu pia go direct to the point so that we can save time. Do you have other questions? I think I can take the last question if there is one.
Kuuliza, there is my question is to the facilitator who gave us the data, data yenye ilikuwa inasema kwamba only 6% of 55% children with disabilities are enrolled in schools. I know she has a way, she can defend it. So is there anything, is this countrywide or it's a region, a certain region? Kama ni countrywide, then there is so much we need to do to ensure that these children with disabilities go to school. Maybe anaweza nijibu. Hii data ni ya countrywide, national wide.
I think Masi, wewe ndio ulitupatia data
55.
Masi?
I think alikuwa Masi.
Okay.
Think as must be. Yes, I can see Rachel's hands up as we wait for Mercy.
Yeah. Rachel, could you kindly ask your question?
Okay, well, mine is just an input. Now I'm asking, can this organization help, at least in these public schools, that these parents, for these parents wasiwe wanafungia wa watoto shuleni, can they come up with can they sit down with the government, waone kama they can at least waweze kuaccommodate hawa watoto shuleni by the government ikiajiri walimu ama hata au caregivers, ndo waweze kuacha kufungia wa watoto mashinani, especially where I come from. Majority of them wamefungiwa mashinani, mpaka hata kuna wale wanafungwa na kamba mpaka hizo mikono na miguu zinakuwa na vidonda, of which to me naona government is failing in a way or another. Thank you.
Okay, thank you so much for your input. I would now like to thank you so much for the session, and I would now like to hand over the session back to Veronica.
Okay, thank you so much, Juma, for a wonderful session. I think today we have the best session and with a lot of people joining. Thank you so much. I don't really have much to say. I'll take it to Craig to finish it for us. Thank you.
Thank you. First of all, I'd like to appreciate everyone for taking time to join us today. It is highly appreciated. I have our closing remarks and a short announcement. I won't take much of your time. And for those who don't know me, my name is Craig Inda, Disability Trust Projects Department. Thank you. Closing remarks. Violence against women and girls with disabilities is a significant issue that is related to both gender and disability-based discrimination, exclusion. Combined, these two factors result in an extremely high risk of violence against women and girls with disabilities. Despite this high risk, there remains a lack of literature regarding the risks of abuse, experiences of abuse, and barriers to seeking and getting help among women and girls with disabilities. The absence of attention to this issue from both civil society and government has contributed to the invisibility and victimization of women and girls with disabilities. The 16 days of activism against gender-based violence is an annual international campaign that kicks off on 25th of November, the International Day for the Elimination of Violence Against Women, and runs until the 10th December, Human Rights Day. The campaign was started by activists at the inauguration of the Women's Global Leadership Institute in 1991. It is used as an organizing strategy by individuals and organizations around the world to call for the prevention and elimination of violence against women and girls. Disability Trust would like to use this period to highlight the experience of women and girls with disabilities on gender-based violence and the lack of effective intervention mechanisms that in turn contribute to its escalation. Thank you. I would also, that's the end of our closing remarks. I'd also like to take this opportunity just to reiterate that our annual SRHR Plus D Festival has been postponed. So we will get a new date. It was scheduled for Mombasa from 29th to 3rd. We shall get a new date on when it shall be. So it has been postponed because of the El Nino that is currently happening in Mombasa. So we're all hoping for better news. Yes, apart from that, it is thank you from me. Thank you from the whole disability team. We appreciate your presence and asanteni sana. Thank you.
Greg, I have a question.
Yes, go ahead.
We have the celebration of World AIDS Day will be on 1st. Can the
1st of December, if I'm not wrong.
Yeah, 1st of December. Can the Ability Trust support 3 to 5 women at least to visit the place that in a Holdiwa on, because it's a bit far, Kilgoris. For them to visit there and to represent other women with disability from the whole Narok County, at least to air and also to represent 1 to 3 on issue on women and girls with disability, please, kindly. It's just a request.
So this is Mercy, right?
Yes, this is Mercy Naro.
Yes, Mercy, baby, you can reach out to me on WhatsApp. Just give me a brief description about what you'd like to do exactly, and then I can seek permission from our management team, and then I can get back to you.
Okay, thank you.
Thank you. Back to you, Joanne. Thank you.
Can I add something for Mercy?
Yes, please.
Mercy amesema ni vizuri kwa sababu women with disability, kuna wengine HIV positive na bado hawa ni disabled. So Mercy, kama hiyo event inaweza kuwa ni vizuri sana kama tunaweza pata watu 2 watatu, pia kuhamasisha watu, kwa sababu wengi wao wakiwa na disability na wako HIV watakuwa discriminated times 2. hivyo ni vizuri pia kama women with disability to input pia kwa upande huo wa HIV, kwa sababu wengi wao wana discriminate hata wenyewe, mpaka unakuta watu wame lose hope in life. So ni vizuri pia tukiwahamasisha. Nimesikia ni vizuri kwa sababu iko Kilgoris na Kilgoris ndio kwetu. Happy for that. Thank you.
Wow, thank you
Asante
very
sana.
much.
Asante sana Josephine for your input na kutueleza. I would like to thank you for this meeting, for attending this meeting, and due to time, kama tujajibu swali lako, pole sana, tutajibu next time. I thank you for attending this meeting, and we hope that we'll share what you've learned here out there. Until next time, goodbye.
Okay, thank you. Greg, please. Are you there?
Yes.
I had a suggestion.
This is Mercy again.
Yeah.
Mercy, we have our usual call, our usual
please. Okay,
tomorrow
no
at 2
problem.
p.m.
Okay,
This can be ended.
Yeah. Thank you. Yeah.
That's what's up. Even